What if we could silence those faulty charges or discharges from your heart without a single cut? That's exactly what cardiac ablation therapy does. When your heart beats irregularly, either it's too fast, too slow, or it's beating out of your rhythm, often due to electrical misfiring within your heart, which can lead to irregular rate and rhythm called as arrhythmia. And now the interesting part, cardiac ablation therapy doesn't fix your myocardial heart muscles. It basically rectifies the wiring of your myocardium. These target the electrical wires within your heart, which causes chaos. Using a very thin tube called as the catheters, the doctors guide them through an approach either through your lower limb veins and reach your heart muscle. Once these catheters are inside your cardiac chambers, they use a method to identify those zones or regions of heart muscle which are misfiring. And then we use either cold, heat or radio waves to burn off these areas called as cardiac ablation. There's no open heart surgery and there is minimal downtime. But what is the prerequisite for a cardiac ablation? The precedent is your symptoms followed by an ECG. Doesn't pick it up, you need a halter or a long time ECG monitoring of your heart, and then this has to be shown for an electrophysiological study to identify these areas of misfiring, and then the procedure of ablation is undertaken. This is not for everyone, but when it's done for the right patient at the right time, cardiac ablation is a life-changing thing for these patients who have arrhythmias. If your heart skips a beat, races suddenly, or it flutters, please do not ignore this. There might be a precise preset way to reset your rhythm. Share this with anyone who does complain of palpitations and who does complain of even sudden loss of consciousness.